My name is Dr. Gita Sinha. I'm from the Department of Anatomy and Neurobiology. This is the third presentation of the Head and Neck series. In this presentation, I will be talking about the anatomy of the trigeminal nerve and infratemporal fossa. The first part will be the presentation of the trigeminal nerve, its three branches and its distribution. The second part will be the contents of the infratemporal fossa. Let me show you the course of the trigeminal nerve on this model. We are looking at the base of the skull into the middle cranial fossa. The green structure which I am pointing by the probe is the trigeminal nerve. Anterior to the trigeminal nerve, this extended area is the trigeminal ganglion. This contains the cell body for all the sensory fibers, and it lies into the dura mater. The nerve anterior to it divides into three branches. The first branch is the ophthalmic nerve. The second branch is the maxillary nerve. And the third branch is the mandibular nerve. Let's take the course of the ophthalmic nerve. The ophthalmic nerve, the first branch, leaves the skull and enters the orbit through this long fissure which is known as superior orbital fissure. Let's get into the orbit. This is an anterior view of the orbit. We are going to look at the course of the ophthalmic nerve in the orbit and its branches. The ophthalmic nerve enters the orbit through the superior orbital fissure. This is the ophthalmic nerve coming out from the superior orbital fissure. It gives three branches here. The first branch is nasociliary, which runs onto the medial aspect of the orbit, and this is going to supply the ethmoidal sinuses, part of the mucosa of the nose, and cornea. The second branch runs on the roof of the orbit, and then it divides into two terminal divisions, the supratrochlear and supraorbital. Supraorbital leaves through a small opening on the superior border of the orbit, and that is known as superior orbital foramen. These branches from the supratrochlear and supraorbital supply the skin over the forehead and the anterior part of the scalp. The third branch is the lacrimal nerve. The lacrimal nerves runs on the lateral aspect of the orbit towards the lacrimal gland. It supplies the skin over the lacrimal gland. So here we finish the branches of the ophthalmic nerve. Let me show you the course of the maxillary nerve. This is the second branch of the trigeminal nerve. It leaves the skull through a round opening. This round opening is known as foramen rotundum. The maxillary nerve leaves the skull and enters in the pterygopalatine fossa through this opening. So here on the face, I'll show you few of the branches of the maxillary nerve. This is the maxillary bone, and the infraorbital nerve supplies the skin over the maxilla. This is the zygomatic bone, and we see this green nerve which is coming out from there. This is your zygomatic facial branch of the maxillary nerve and supplies the skin over the zygoma. The maxillary nerve also supplies all the maxillary teeth. It supplies the maxillary sinus, the hard palate, and the mucosa of the nose. One of the important points I would like to tell you at this point, the ophthalmic nerve and the maxillary nerve, they lie on the lateral wall of the cavernous sinus. Now I'm going to talk about the mandibular nerve. The mandibular nerve, that is the last branch, leaves the skull through this round opening. I've got my probe into this round opening, which is known as foramen ovale. After leaving the foramen ovale, it enters into the infratemporal fossa. And I'm going to trace this again on the prosection. On this model, I'm going to show you the boundaries of infratemporal fossa. Right now, I'm pointing the region of the temporal area. The infratemporal fossa lies inferior to this region, and now I'm pointing to the area of infratemporal fossa. Now, let me tell you the boundaries of the infratemporal fossa. The lateral boundary is formed by the medial surface of the ramus of the mandible. So this is the medial surface of the ramus of the mandible. On the medial boundary, we see my probe is showing the lateral pterygoid plate. The superior boundary is formed by the base of the skull. So now my probe is in the superior aspect of the infratemporal fossa, and now it's traveling down towards the middle and the inferior part of the infratemporal fossa. This region is filled by the muscles of mastication, maxillary artery, pterygoid plexus of veins, and branches of the mandibular nerve. Now I'm going to show you all these structures on a prosection. On this prosection, I'm going to show you the sensory innervation of the three branches of the trigeminal nerve. The ophthalmic division supplies part of the nose, the upper eyelid, the skin of the forehead, and anterior part of the scalp. And it's here shown by this black line coming to the medial canthus of the eye, then coming from the lateral canthus of the eye and bounded by this black line. So this area is by the ophthalmic division of trigeminal nerve. The red area which is shown here over the maxilla, the zygoma, the lower lid, part of the nose, and the skin over the upper lip, this is supplied by the maxillary nerve. It's bounded by these black lining, which is the red area. The mandibular nerve supplies the skin over the chin, the lower lip, the part of the mandible, the ramus of the mandible, and the region of the temple. So that's sort of gives the pain, temperature, touch, pressure onto the skin of the face and forehead. So on this prosection, I'm going to talk about the muscles of mastication, and these are four muscles: the temporalis, masseter, medial pterygoid, and lateral pterygoid. Let me start and show you with the position of the masseter muscle. Now here, this rectangular muscle, which defines the jaw line of a person, is the masseter muscle. These are the anterior border of the muscle, and this is the posterior border of the muscle. The fibers attach to the zygomatic bone, and the lower attachment is over the mandible. When this muscle contracts, it elevates the mandible. So it's a very powerful elevator of the mandible, and especially helps in grinding and chewing the food. The second muscle I would like to show is the temporalis muscle. This is a fan-shaped muscle. The fibers are coming from the temporal bone. There is a superior temporal line and inferior temporal line where the fibers are attached. They come together in a triangular fashion and attach onto the coronoid process of the mandible. This muscle, again, when the fibers, these fibers, the anterior and the middle fibers, when they are contract, they pull the mandible up. Thus, this is another elevator of the mandible and helps in closing the mouth. The posterior fibers, which are also referred sometimes as horizontal fibers, they are coming very, very straight horizontally in the posterior aspect of the muscle. These fibers, when they contract, they retract the mandible. So, these are the two elevators, the masseter and the temporalis. Let's go deeper down in the infratemporal fossa. Now, look at this muscle, which is very horizontally placed in the deeper aspect of the face or into the infratemporal fossa. This muscle is the lateral pterygoid muscle. It has two bellies. There is a superior belly, and then there is inferior belly, which is this belly here. The superior margin of the inferior belly, inferior margin of the inferior belly. This muscle attaches to the lateral surface of the lateral pterygoid plate, which is this area here, pointing by the probe, and comes down to the neck of the condyloid process, as well as the fibers attached to the capsule of the TN joint. This muscle is the protractor. When it contracts, it protracts the jaw. It also helps in the side-to-side movement. Now we look at the fourth muscle, which is not very well shown on this side of the prosection, but we can see some of the fibers. This is again very obliquely set into the face, and the direction are almost like the masseter muscle. So it's very obliquely placed on the inner side of the mandible. You can see the fibers coming down, and these fibers are attached on the medial aspect of the pterygoid plate. The fibers come down in this direction, so this is the whole muscle, and attaches to the medial aspect of the mandible. When this muscle contracts, it protracts, as well as it helps to elevate the mandible. The nerve supply of the four muscles of mastication, and that is by the mandibular branch of the trigeminal nerve. They supply the muscles of mastication. On this prosection, I'll talk about the contents of the infratemporal fossa. First, I will take you to the branches of the mandibular nerve. Then we are going to talk about the maxillary artery. And only I will like to remind you that pterygoid plexus of vein is lying in here, but it is difficult to show you the pterygoid plexus. Let's orientate ourselves. This is your masseter muscle. The zygomatic bone is cut. This is your temporalis muscle, and that has been reflected upwards. Now we are into the infratemporal fossa, and my probe is into the foramen ovale. That's where we can see the mandibular nerve or mandibular nerve or mandibular branch of the trigeminal is coming out in the infratemporal fossa. It gives 4 branches here. The first branch is the buccal branch. This is the nerve which I'm holding in my probe. The nerve pierces the buccinator muscle. We can see it's piercing this muscle, which is the buccinator muscle, and supplies the mucosa inside the cheek. The second branch, which I am going to follow from the main stem, and this is your lingual nerve. I'm holding with my probe. This is the lingual nerve, and look at the position of the lingual nerve. The lingual nerve lies anterior to its third branch, and this travels to the tongue and supplies the general sensory to the anterior 2/3 of the tongue. Posterior to that is the inferior alveolar nerve, and I think I'm holding the inferior alveolar artery too. The inferior alveolar nerve gives a branch which is called as nerve to mylohyoid. The nerve enters in the into the mandibular foramen and gives branches to all the mandibular teeth inside the mandibular canal. This nerve is often blocked to give anesthesia to the lower teeth. The fourth branch runs posteriorly from its origin towards the TM joint, crosses the TM joint, and comes towards the temporal region and the auricular region. It supplies the skin in this area, but before doing that, it forms a loop around the middle meningeal artery. So now my probe is holding the middle meningeal artery. Well, another thing which we can see very well in here is the medial pterygoid muscle. So this is the boundary of the medial pterygoid muscle. You can see it's coming from the medial surface of the lateral pterygoid plate and going downwards towards the angle of the mandible. So here this whole muscle is the medial pterygoid muscle. Talking about the artery in the infratemporal fossa, now I'm picking up the maxillary artery. The maxillary artery gives 2 important branches, the inferior alveolar artery, which runs with the inferior alveolar nerve and enters the inferior in the mandibular foramen to supply the gum and the maxillary mandibular teeth. Now I am holding the middle meningeal artery, and that enters the skull through this opening where my probe is pointing at the moment, and this is the foramen spinosum. The middle meningeal artery leaves the infratemporal fossa and enters the skull to supply the meninges. Inferior alveolar nerve gives a small branch before it enters the mandibular foramen. And this little branch, which I'm holding now, is known as nerve to mylohyoid. This is a motor branch which supplies 2 muscles, the mylohyoid muscle and anterior belly of digastric. Now I will talk about chorda tympani. Now, chorda tympani is a branch of facial nerve. That is your 7th cranial nerve. This branch is given in the middle ear cavity, leaves the skull, and joins the lingual nerve in the infratemporal fossa. The chorda tympani contains the sensory fibers for anterior two-thirds of the tongue and parasympathetic fibers. These fibers travel in the lingual nerve. The parasympathetic fibers then will synapse in the submandibular ganglion and distribute it to the submandibular gland and the lingual gland. The special sensory fibers will go to supply the anterior two-thirds of the tongue. So now we have finished all the contents of the infratemporal fossa. We have looked at the mandibular nerve, its 4 branches, the buccal branch, the lingual branch, inferior alveolar branch, and auriculotemporal branch. We also looked at the arteries in this region is the maxillary artery. We cannot see the pterygoid plexus of vein which lies onto the lateral pterygoid plate and connected to the cavernous sinus and the inferior orbital nerve and the facial nerve. And we also saw the chorda tympani, the branch of the facial nerve, coming and joining the lingual nerve and supplying the 2 salivary glands in this region, the submandibular and lingual gland. I think that completes the demonstration of the infratemporal region. So question number 1. What nerves gives innervation to the area pointed by the red marks? Be specific. Question number 2. Give 2 functions of the muscle pointed here by my probe. Question number 3. Identify this structure and give its distribution. Question number 4. Identify this structure, and the second part of this question is, what type of fibers are contained in this structure at the point where I am holding by the probe? Question number 5. Identify this structure. Question number 6. Name 2 muscles which attach to this bony plate. Question number 7. Identify the structure near the probe. Question number 8. Identify this structure or identify this muscle and give 2 functions of this muscle. Question number 9. Identify the structure and give its nerve supply. Question number 10. Identify the structure Answer number 1. The area which is painted here by red dots, this is the area which is supplied by the branches of the maxillary nerve of the trigeminal. And the infraorbital branch and zygomaticofacial branches, they come out and supply the skin over this area, which is a butterfly-shaped area in the middle of the face. The margins are by the lateral canthus of the eye and the corner of the lip. That's where the demarcation changes. Answer number 2. I'm pointing to the temporalis muscle. The anterior and the middle fibers of this muscle, when they contract, they pull the coronoid process upwards. Thus, they close the mandible. So this is a very strong elevator of the mandible. The posterior fibers of this muscle, which are very horizontally placed, they pull the mandible backwards. And so it helps in retracting the mandible. Answer number 3. I'm pointing to the buccal branch of trigeminal nerve. And this, you can trace it where it is piercing the buccinator muscle. So that's your landmark which you use to identify the buccal nerve. And the second part of the question is distribution. It supplies the mucosas of the cheek, inside the cheek. Answer number 4. I'm holding the lingual nerve. Look at its position. It lies anterior to inferior alveolar nerve. You can see the inferior alveolar nerve lying posteriorly. This is coming from the main stem of the mandibular nerve. And the second part of the question is asking what type of fibers it contains. At this point where I'm holding it by probe, it's containing the general sensory fibers for the anterior 2/3 of the tongue. It's also containing the special sensory fibers for the anterior 2/3 of the tongue and preganglionic parasympathetic fibers, which will be distributed to the submandibular gland and sublingual gland, because it's after it joins the chorda tympani. The parasympathetic fibers, preganglionic parasympathetic fibers and special sensory fibers are joined into the lingual nerve at this point. Answer number 5, the maxillary artery. You can also see some of the landmarks. You can see inferior alveolar artery coming out, and you can also see the middle meningeal artery coming and going upwards. Answer number 6, lateral pterygoid muscle and medial pterygoid muscle. This is your lateral pterygoid plate. The lateral surface gives attachment to the lateral pterygoid plate, and the medial surface gives attachment to the medial pterygoid plate. Answer number 7. The structure I'm holding is the auriculotemporal nerve, and you can see its relation to the middle meningeal artery. It's encircling the middle meningeal artery and going towards the TM joint, coming out from the main stem. This is the main stem of mandibular nerve. Answer number 8. This is your medial pterygoid muscle. You can see it's coming from the medial surface. This is the pterygoid plate, and it's coming on the medial surface towards the angle of the mandible. The fibers run on the inside of the mandible, parallel to the masseter muscle. So in the medial pterygoid and the masseter, they make the two ropes of the swing. If the mandible is a swing, this is the inner rope of the mandible. And usually between the masseter and the medial pterygoid, the mandible swings up and down. The two function is protraction and elevation. Answer number 9. The muscle which I am pointing right now is your lateral pterygoid muscle. You can see it's coming from the lateral pterygoid plate, attaches to the neck of the condyloid process, the capsule of the TM joint. This is the TM joint. And the nerve supply to this muscle is the mandibular nerve. The 4 muscles of mastication are supplied by the mandibular nerve. Answer number 10. This is your inferior alveolar nerve. You identify this nerve in relation to the lingual nerve. Lies posterior to the lingual nerve, along with the inferior alveolar artery going inside the mandible. You cannot trace any further because the nerve is running in the mandibular canal.